A couple weeks ago, I posted a video about an after-hours emergency where a patient was accidentally hit in the eye with a tree branch. She ended up with a fairly significant corneal abrasion, and because of the shape of the injury, actually had a debride part of the corneal surface. So today I want to give you an update on how the eye healed. If you didn't see the original video, the patient came in after being struck in the eye by a tree branch. On exam, she had a corneal abrasion, which is basically a scratch on the front clear surface of the eye. But this wasn't just a simple tiny scratch. It was in the triangular shape that I hate to see with abrasions. Essentially, every time she would blink, her eyelid would grab that point and pull a little bit more of the epithelium off, making the abrasion bigger and bigger. So I had to clip that little bit of tissue off and blunt the edges a bit to stop that from happening. Also, because of the size and shape of the abrasion, I placed a bandaged contact lens on the eye. I don't do this on patients that normally wear contact lenses because of increased risks, but she doesn't normally wear contacts, so I put that bandaged contact lens on. Now, a bandaged contact lens isn't being used to improve vision like a normal contact lens. Instead, it acts like a protective covering for the cornea. It helps reduce pain, protect the healing tissue, decrease friction from blinking, and improve overall comfort while she's healing. So I kept that contact lens on for about 3 days while that surface healed. I also started her on some steroid antibiotic combination drops, antibiotic to keep infection away, steroid to calm that inflammation down so that the eye can heal up a little bit better and a little bit easier. That steroid will also decrease the risk of a recurrent corneal erosion. And then I also started her on a low dilation drop just to use a couple of times a day to just help ease that pain just a little bit. We also discussed doing an amniotic tissue on the cornea to see about expediting the healing process, but after a little discussion with the patient, we decided not to mess with it. Now, the good news is the cornea healed very well. At the 2-week follow-up, the abrasion had fully resolved, the surface looked nice and smooth, there was no significant scarring, and vision had recovered back to 20/20, which is exactly what we want to see after an injury like this. Now, here's the thing. The cornea actually heals remarkably fast in many cases, but the key is making sure the tissue heals properly and that infection or recurrent corneal erosions don't develop afterwards. That is why I placed her on that steroid antibiotic combination drop to help calm down that inflammation and keep infections at bay. The reason I take tree branch injuries so seriously is because organic material can increase the risk of infection. Anytime something like a branch, yard material, yard debris, plant material hits the eye, we have to be careful about bacteria and even certain fungal infections. That's why eye injuries should never just be ignored at home. If pain is significant, light sensitivity develops, vision becomes blurry, or the eye stays red and irritated, a lot of people assume it is just a scratch. But some corneal injuries can become much more serious if not treated properly. Things can happen like recurrent corneal erosions where the epithelium keeps getting ripped off the eye first thing in the morning, or even worse, fungal infections, which are absolutely horrendous. Now, the biggest takeaway here is that even though this injury looked pretty concerning initially, prompt treatment and close follow-up helped the eye heal successfully. And honestly, this is also a good reminder to wear eye protection during yard work or trimming branches whenever possible, because most people never think an eye injury is going to happen to them till it does. If you enjoy seeing real-world eye cases like this, consider subscribing because I post weekly videos about eye injuries, eye diseases, and vision problems explained in plain English.